Hey future nurses, are you looking for an online NCLEX course? You're in the right place. Embark on your journey to NCLEX success with our all-inclusive online course, offering a comprehensive blend of animated crash courses, recorded video lectures, a question bank containing over 3,000 practice questions, NGN questions, mock exams for a realistic test experience, audiobooks, ebooks, and a bullet points book. Everything you need to ace the exam all in one place. Here's a sneak peek into what our course offers. Animated crash course. Engaging animations cover all key topics tested in the NCLEX exam. With over 100 questions derived directly from our crash course, you'll be prepared for anything the exam throws at you. Recorded video lectures. Learn from the best NCLEX trainers in the world. Our recorded lectures provide in-depth explanations and strategies to tackle even the toughest questions. Question bank. Practice makes perfect. Access over 3,000 NCLEX practice questions carefully selected based on the most frequently tested topics over the past 5 years. NGN questions. Gain access to next-generation NCLEX-style questions to familiarize yourself with the latest exam formats and requirements. Mock exams. Experience the real exam environment with our mock tests designed to simulate the NCLEX exam to perfection. Audiobook and ebook. Study on the go with our audiobook and ebook versions covering all essential nursing topics for your convenience. Bullet points book. Need a quick review? Our bullet points book condenses key information into easy-to-digest format for fast revision. Don't miss out on this opportunity to accelerate your journey towards becoming a licensed nurse. Enroll now and enjoy a 70% discount exclusively for early birds. Act fast, as this offer is valid only for this month. After that, prices will rise. Don't let this chance slip away. Invest in your future today. The patient care assistant, PCA, typically assigned to an adult unit, informs the nurse that a 2-year-old child's blood glucose level is within the normal range at 82 mg per dl. The nurse's response to the PCA is informed by the knowledge that the target blood glucose range for a toddler is A. 60 to 100 mg per dl. B. The ideal range is between 80 and 120 mg per dl. C. The range is 90 to 150 mg per dl. D. The range is 100 to 180 mg per dl. The answer is D. The range is 100 to 180 mg per dl. A blood glucose level of 82 mg per dl is considered to be on the lower side. The recommended range for preprandial blood glucose levels is 100 to 180 mg per dl. Toddlers are at a heightened risk of experiencing hypoglycemia and may struggle to identify the associated symptoms. Attempting to manage the child's levels below 100 mg per dl carries significant risks. The target blood glucose ranges for a toddler in options A, B, and C seem to be set too low. An ambulatory care clinic is visited by a parent bringing their 6-month-old infant for a routine well-child appointment. The infant has no previous health problems. The senior student nurse, in collaboration with a registered nurse, RN, concludes the infant's physical assessment and informs the RN that the baby's pulse rate is 170 beats per minute and the infant is alert and composed. What should be the nurse's initial step in assessing the precision of this measurement? A. Take the infant's vital signs and perform a thorough assessment right away. B. Inform the physician about the abnormal findings. C. It would be helpful for the student to inquire about any family history of cardiovascular disease from their parent. D. Instruct the student to compare the current heart rate with readings from previous clinic visits. The answer is D. Instruct the student to compare the current heart rate with readings from previous clinic visits. It is important to compare the value to both the norms for the infant's age group and the infant's previous readings. The normal heart rate for an infant aged 1 to 11 months is typically between 80 and 160 beats per minute. Temporary increases in heart rate can be caused by environmental changes and stressors. The student is responsible for carrying out the action, but the RN remains accountable for the outcome and must provide any necessary follow-up. The infant's heart rate is within the normal range, so there is no need for an immediate reassessment or to notify the physician at this time. Further information should be collected before taking any further action. If the findings are normal, the physician will not be notified. Cardiac problems are uncommon in infants. Cardiovascular diseases that are typically observed in adults are uncommon in this young age group. The assessment of a 4-year-old diagnosed with meningitis reveals an altered level of consciousness, decreased urine output, and a temperature of 103.4 degrees Fahrenheit, 39.7 degrees Celsius. An LPN working on an adult oncology unit arrives with a willingness to assist in any way possible. Which task can the RN assign to the LPN? A. Informing the healthcare provider. B. Examining the size of the child's pupils. C. Administering an acetaminophen suppository. D. Removing additional blankets and clothing from the child's bed. The answer is D. Removing additional blankets and clothing from the child's bed. It is important to take measures to lower the child's temperature, such as removing any extra blankets and clothing. The RN should be in communication with healthcare providers. Only registered nurses are authorized to accept verbal orders from healthcare providers in most healthcare facilities. The assessment of the child, including pupils, is the responsibility of the RN and should not be delegated. The LPN may not be familiar with the typical size of a 2-year-old child's pupils. The LPN's experience on an oncology unit may not necessarily translate to administering a suppository to a 2-year-old child. This task requires specific skills, such as using a smaller finger and shorter depth. Additionally, the RN may not have the opportunity to assess the LPN's ability in this particular area. The nursing assistant is responsible for completing the intake and output (I&O) records for clients at the end of an 8-hour shift. At the end of the shift, an LPN informs the RN that a new NA on the unit has not finished the task. What should the RN do in this situation? A. Ask the LPN to complete this task as the information is required for the report. B. Kindly remind the NA of the urgency in completing the task promptly. C. Inform the charge nurse about the need for further orientation on job responsibilities for the NA. D. Inquire with the NA about the instruction provided regarding job responsibilities and request them to explain the process of totaling intake and output records. The answer is D. Inquire with the NA about the instruction provided regarding job responsibilities and request them to explain the process of totaling intake and output records. When assigning tasks, it is important to consider the delegate's knowledge and ability to perform the task correctly. It may be helpful to ask for clarification on the given instruction to better understand what the NA was told and how the RN interprets the task. The RN or LPN may need to provide the NA with the necessary forms to complete once they have documented the amount of intravenous infusions. The delegation of job responsibilities assigned by the NA can be inappropriate and may lead to tension among team members. If the NA is not familiar with how to calculate I&O records, simply reminding them may not be enough. It may be too early to notify the charge nurse. We require more information about why the NA is unable to complete the task. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course, and for this month only. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations, but that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. say farewell to monotonous study sessions, and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. The RN is notified by the NA that a client, who was admitted to the hospital last night with chest pain, intends to leave immediately because the pain has subsided and they feel that no one has taken any action. What is the best course of action for the nurse? A. Express gratitude to the NA for providing the information and proceed to contact the client's doctor regarding the situation. B. Inform the NA that the client is entitled to depart and assign them to assist the client with packing. C. Engage in a conversation with the client to address their concerns and provide a clear explanation of the care plan. D. The NA should advise the client to remain in place as it is not safe to leave. The RN will promptly discuss the test results with the client. The answer is C. Engage in a conversation with the client to address their concerns and provide a clear explanation of the care plan. Observing the client offers a chance to conduct a more thorough evaluation and provide educational guidance. It is the nurse's duty to keep clients informed about the progress of their care. False imprisonment refers to the act of unjustifiably detaining someone. The client is entitled to terminate the agreement. It is not appropriate for the nurse to delegate the responsibility of assisting the client to pack or speaking to the client to the NA. Explaining the reasons for the client to stay in the hospital is necessary, rather than just stating that it is unsafe to leave. It's too early to call the physician. A nurse manager is reviewing assignments for an evening shift. When should the nurse manager step in if an experienced licensed practical nurse, LPN, is assigned to a certain task? A. Administer a foot soak for a 50-year-old client with an infected heel ulcer. B. Help a 40-year-old client who is 6 hours post-operative following a vaginal hysterectomy to sit at the edge of the bed and then walk. C. Discharge a 30-year-old client with a wound drain following a right mastectomy 3 days ago who still requires instruction regarding the wound drain. D. Perform intermittent urinary catheterizations for residual urine for a 58-year-old client who underwent an abdominal hysterectomy a couple days ago. The answer is C. Discharge a 30-year-old client with a wound drain following a right mastectomy 3 days ago who still requires instruction regarding the wound drain. The client, who is 30 years old, will require education regarding the management of the wound drain, as well as support for their psychosocial and physical well-being as they prepare for discharge. The client's readiness for discharge should be assessed by the registered nurse, RN. Assigning nursing tasks for stable clients with expected outcomes to the LPN is appropriate. Which intervention can a registered nurse, RN, who is managing a mental health unit assign to an unlicensed ancillary staff member? A. Implementing an as-needed PRN order for physical restraints on a 35-year-old client with a history of aggressive behavior who is threatening to tear the place apart. B. Transporting a group of clients diagnosed with chronic alcoholism to an off-unit Alcoholics Anonymous meeting. C. Explaining to a client diagnosed with obsessive-compulsive disorder the reason for not allowing them into another client's room. D. Evaluating a client's ability to self-monitor blood glucose levels in a depressed state. The answer is B. Transporting a group of clients diagnosed with chronic alcoholism to an off-unit Alcoholics Anonymous meeting. The RN may find it suitable to assign non-invasive interventions to an unlicensed ancillary staff member. The RN is accountable for conducting thorough assessments, developing comprehensive plans, and carefully analyzing client information. They are also responsible for implementing and evaluating client care, providing supervision, initiating educational sessions, and administering intravenous medications. Transporting clients to off-site treatments is the only task that can be delegated to unlicensed ancillary staff. Other options require more complex nursing judgments. Procedures that require physical intervention, evaluation of client information or behaviors, or teaching falls under the responsibility of registered nurses and should not be delegated. A client is coming back to unit following electroconvulsive therapy, ECT treatment. Which intervention can a nurse assign to an unlicensed ancillary staff member? A. Assessing the client's level of consciousness. B. Monitoring the client for signs of restlessness or agitated behavior and promptly notifying the nurse. C. Helping the client with their initial food and beverage consumption following the treatment. D. Reassuring the client's family that the client's memory loss is typically temporary. The answer is B. Monitoring the client for signs of restlessness or agitated behavior and promptly notifying the nurse. All of the options for implementing post-ECT care are suitable, but it is important for the nurse to delegate only non-invasive tasks that do not require nursing judgment. It is appropriate to request the ancillary staff member to observe the client's behavior and report any changes. Assessing the level of consciousness is a crucial task that falls under the direct responsibility of nurses and cannot be assigned to others. Given the client's condition of an absent gag reflex, it is important for the nurse to be present during the client's first meal or drink after the treatment. Delegating this task to someone else would not be appropriate. It is important not to delegate the task of teaching the family. A registered nurse acknowledges the importance of providing additional education on the scope of practice for an ancillary staff member when the staff member volunteers to perform which task? A. Assist in coordinating the smoking breaks for the clients on the unit. B. Transport a 28-year-old client diagnosed with schizophrenia to an off-site eye appointment. C. Ensure regular visual observation every 20 minutes for a client who has expressed suicidal ideations. D. Assessing the possibility of removing restraints from a client displaying aggressive behavior. The answer is D. Assessing the possibility of removing restraints from a client displaying aggressive behavior. Ancillary staff are not responsible for evaluating client status, condition, or behavior as part of their scope of practice. It is not the responsibility of ancillary staff to determine whether the removal of physical restraints is therapeutic. Other interventions can be carried out by ancillary staff as determined by the RN. Before we move forward, here's some exciting news. Our 100-hour animated NCLEX review course is now available at a whopping 70% discount for this month only. In the first 30 hours, we cover all essential NCLEX topics with engaging animations. Then, dive into 5,000 NCLEX questions all brought to life with dynamic animation. Plus, you'll get access to NGN questions, an ebook, mock tests, and more. Say goodbye to dull textbooks and hello to an interactive learning experience. Enroll now and secure your success with our animated NCLEX course. Click the link in the description box to get started. The registered nurse is delegating actions to a nursing assistant while caring for an elderly client diagnosed with dementia due to metastatic brain cancer. Which action is improperly assigned to the NA? A. Assisting the client with toileting before getting them settled in bed for the night. B. Notifying the family about the need for a follow-up brain scan for the client. C. Going for a stroll with the client in the beautiful gardens on the hospital grounds. D. Consistently reminding the client of the current date to help them stay focused and organized. The answer is B. Notifying the family about the need for a follow-up brain scan for the client. Ancillary staff are not responsible for managing client care as part of their scope of practice. The RN cannot delegate the responsibility of discussing the client's diagnostic needs to the ancillary staff. It is appropriate to delegate tasks such as assisting with basic cares, such as toileting, ambulation, and communicating with a client to assist in the client's orientation. A nurse is admitting a client diagnosed with obsessive-compulsive disorder, OCD, with struggles with ordering tissues. Which intervention can be assigned to ancillary staff by the nurse? A. Helping the client store personal belongings to reduce their anxiety. B. Requesting the client to provide contact information for a designated person to be notified about their admission. C. Outlining the general unit rules that the client will need to adhere to. D. Suggesting that the client reach out to someone if they are experiencing feelings of anxiety or excitement. Here's the answer. A. Helping the client store personal belongings to reduce their anxiety. Ancillary staff are not responsible for managing client care or performing invasive procedures. For individuals with OCD, specifically those who have a tendency to obsessively organize things, storing their belongings can be a source of stress if not done in a specific manner. Helping the client store their belongings in a way that minimizes stress is a task that the RN can assign to the ancillary staff. It is possible that ancillary staff may not take on the other interventions as they require some level of care management.